If you're new here, I'm Dr. Amy Marschall. I am a licensed psychologist, ADHD adult, expert on neurodiversity affirming mental health care, and the author of Neurodiversity Affirming Therapy, What Every Mental Health Provider Needs to Know. I wrote this book to help clinicians move beyond awareness of neurodiversity into truly affirming practice of our neurodivergent clients. The Center for Disease Control estimates that about 20% of the population has some sort of neurodivergence. And so if you are a mental health provider, you are probably working with neurodivergent clients. I have put together this video to give you 5 essential tips to pay attention to in your work and to help you move into a framework of providing neurodiversity affirming care. First, stop pathologizing difference by default. Let's distinguish between a difference and distress. Many neurodivergent traits like stimming, fidgeting, different communication styles, different sensory responses to different stimuli are not necessarily a problem to be fixed, but simply a difference to be honored and to be supported. Our role is to support clients in navigating a world that's not designed for their brain and their nervous system, not to normalize them or fix them at the expense of their well-being. Second, any clinician working with neurodivergent clients needs to understand neurodivergent masking and the toll that masking takes on clients. Pay close attention. Many neurodivergent individuals from an early age have learned to hide our authentic ways of being and our true selves in order to survive, in order to be physically and psychologically safe, and in order to get by socially or professionally. Masking can make us appear high functioning when we're actually just hiding our true needs. It comes at the expense of chronic exhaustion, anxiety, depression, and even rounds of burnout. Affirming therapy aims to create a space for clients to unmask safely and at their own pace. Third, reframe your goals to focus on fostering autonomy rather than compliance. Be intentional about how you set goals for your clients. Being neurodiversity affirming prioritizes consent, autonomy, and prioritizes quality of life over compliance or the appearance or performance of neurotypicalness. Ask yourself, what actually helps this client to feel and be safer, regulated, and more themselves? Fourth, adapt the therapy, not the client. Flexibility matters. Affirming language means adapting approaches, whether that's the pacing, the language, the structure, the sensory environment, the communication styles, or the goals, rather than expecting clients to conform to traditional therapy norms that might not work for them and their brain. And finally, number 5, always, always, always examine the power, identity, and the role of intersectionality. Neurodivergence alone does not exist in a vacuum. Neurodivergent people's identities and experiences are also informed by race, gender, other disability, trauma history, cultural context. All of these things shape how we are perceived and how we're treated in the world, including by our mental health professionals. Ethical and affirming care requires that ongoing self-reflection and humility as providers to ensure that we are meeting our clients where they are and avoiding harm. My book, Neurodiversity Affirming Therapy, offers practical guidance, clinical examples, and concrete strategies to help you do this work ethically and compassionately. If you work with neurodivergent clients, this book is an essential resource. I hope to connect with you and provide resources and support that elevate your practice and help you be the best provider for your clients. Thank you.